Welcome to Chapter 4, Assessing Needs in Health Promotion. This chapter is about the very first step in any successful health program, understanding the problem. We'll explore what a needs assessment is, why it matters, and how to conduct one effectively. Let's start with the basics. What is a needs assessment? A needs assessment is a formal process of identifying and analyzing health problems within a specific population. It helps determine what issues exist, how widespread they are, and what can be done to address them. First is it identifies the gap between what is and what ought to be. Second is it provides a data-driven foundation for program planning. Third is it builds community and stakeholder support by involving them early. The results of a well-conducted needs assessment guide everything else in your program, from setting priorities to choosing strategies and evaluating outcomes. Now let's break down the types of needs. There are three major types. First is actual needs, problems that are supported by objective data, like high obesity or diabetes rates. Second is perceived needs, what individuals or communities believe their problems are. Third is normative needs identified by comparing a group to national or professional standards. A good assessment takes all of these into account. So, when should a needs assessment be conducted? Ideally before program planning begins. However, it may also be used mid-program to adjust strategies, or after a program ends to inform future efforts. There are several models for conducting needs assessments. One common example is the health impact assessment. This approach predicts how a policy, program, or project might affect the health of a population, especially vulnerable groups. It includes screening, scoping, assessment, recommendations, reporting, and monitoring. Another model is the epidemiological approach, which focuses on using morbidity and mortality data to define and prioritize health problems. Next, let's walk through the 6-step process of conducting a needs assessment, as outlined in your textbook. Step 1. Determine the purpose and scope of the needs assessment. Why are you conducting it? What do you hope to learn or achieve? What are your time and resource limits? Step 2. Gather data. There are two types of data. Primary data is collected directly from the priority population through surveys, interviews, focus groups, or observation. Secondary data comes from existing sources like CDC databases, hospital records, census data, or academic articles. Step 3. Analyze the data. Look for patterns, trends, and disparities. Compare results to national benchmarks or guidelines like Healthy People 2030. Step 4. Identify the factors linked to the health problem. This may include behavioral, environmental, genetic, and social determinants. Tools like the PRECEDE model can help classify these as predisposing, reinforcing, or enabling factors. Step 5. Identify the program focus. Prioritize the most changeable and significant problems. Consider feasibility, cost, community readiness, and political will. Step 6. Validate the identified need. Go back to your stakeholders. Share your findings and confirm that the conclusions make sense to those who know the community best. Throughout this process, it's important to engage the priority population. They provide insight, context, and often solutions you won't find in data alone. Involving them builds trust, credibility, and long-term support. Let's now highlight some common data collection methods. Surveys efficient, scalable, and good for quantitative data. Interviews rich qualitative insight from individuals or key informants. Focus groups, small group discussions that reveal community attitudes and perceptions. Observation, useful for environmental or behavioral assessments. Photo voice, a participatory method where participants use photos to express needs and priorities. And finally, remember that equity and ethics matter. When collecting data, protect participant confidentiality, gain informed consent, and respect cultural norms. Be especially sensitive to power dynamics and the potential for exploitation. To summarize Chapter 4, first, a needs assessment identifies what problems exist and what matters most to the community. Second, it provides the evidence needed to build effective, targeted, and sustainable programs. Third, it involves collecting and analyzing both primary and secondary data. Fourth, it includes community voices to ensure relevance and buy-in. And fifth, it sets the stage for all future planning, implementation, and evaluation. Thank you for watching this video. This concludes Chapter 4, Assessing Needs in Health Promotion. Based on planning, implementing, and evaluating health promotion programs by James McKenzie, Brad Neiger, and Rosemary Thackeray. Stay tuned for Chapter 5.